Welcome back to the DocBuddy Journal. I'm your host, Erik, and today we've got a fantastic guest. We've got Greg DeConciliis, who's the administrator of Boston Outpatient Surgical Suites. Greg, thanks for joining us today.
Thanks for having me. Appreciate it.
It is absolutely our pleasure. And before we get into the meat of the show, why don't we take a minute here, tell the audience a little bit about yourself, where you're located, and what you're doing up at Boss.
Sure. My background is actually clinical. I started as a PA in orthopedic surgery for about 4 years at New England Baptist Hospital. Left in 2004 to open up our surgery center. It's called Boston Outpatient Surgical Suites. We're actually not in Boston. We're in the Metro West area of Boston. We were kind of early pioneers in 2004 doing a freestanding ASC with orthopedics, right? And we have a lot of GI and ophthalmology centers up here, but we're a multi-specialty center doing, again, ortho, pain management, doing some general surgery. We're actually exciting times. We're going to a 8 OR center located about a couple miles from here, going through the kind of final stages of sign-offs and all that kind of stuff, and hopefully moving in the next couple of months here. And there's that much, obviously, demand in the area that we're expanding and growing it. So we're exciting times.
Yeah, that's really exciting. More than double the ORs. That's definitely one to ice the champagne down for to have that take go through your center.
For sure.
And I gotta take a beat here too, because Boston's a fantastic city, one of America's best in my opinion. But what you said, just west of Boston, that is so pretty. That is a great part of the
country. We're right on the kind of the 95 belt. It works out really, really well. Actually, the city's going to be putting in a new exit off the highway right there too. And the area we kind of went into, we're just really fortunate. It's a little shopping area as well. And, we relocated all the medical offices as well, PT. And so it's going to be kind of one-stop shopping, which is going to be nice.
You love that. And in a great part of town too.
Yep.
And that's kind of a nice segue, because also in this great part of town, we're talking about Newton specifically, coming up in just about 2 months rather, is the New England ASC conference. That's October 24th. It's 8 to 5, 1-day show. We'll have a link in the show notes to point people to that page, so both attendee and vendor can register alike. Greg, you organized this event. What should folks be looking forward to in October?
Yeah, I'm the president of our state association here in Massachusetts, and probably about 10 years ago, maybe a few years, maybe even 11 or 12, we took a break, obviously, during COVID. I recognize that a lot of these smaller ASCs, particularly in our area here, couldn't afford the larger conferences. They're expensive, and they didn't have the budgets or maybe even the staff to kind of be out for a few days. Obviously, they occur typically during the week. And then, when I first started being involved in our association, New Hampshire had a really strong association, and they're not a CON/DON state, and so they've had a big flurry of ASCs, and so to kind of pull this Northeast group together, there's not a ton of ASCs in Vermont, not a ton in Maine, not Rhode Island as well. Certainly south of that, New Hampshire, Connecticut. Even New York and New Jersey, a lot of ASCs and really, really great, strong associations, great programs they have, but really nothing up this way. And so I sought out to kind of pull everybody together. I actually scout out at either Becker's or Ask a meeting and find great speakers and try and bring them to us. Rely on sometimes the vendors or management companies to bring speakers in. And we just kind of have a one-day conference that's geared towards both clinical and business personnel. A lot of administrators, we get CEU credits, CAS credits, and so it's a nice little shop. We actually are going over to Newton this year. We've been in Waltham, actually right up the street at Mass Medical Society for the last 9 years, and Newton's going to give us more space for hopefully a larger crowd and more vendors. We have a really great time that we set aside with the vendors. Great opportunities for attendees to see the vendors, get raffle tickets for prizes and that kind of thing. So we try and make it a nice day. We have it on a Friday. So, of course, you start seeing people filtering out there in the afternoon. But for those who want to stay, we get some great talks later in the afternoon as well. So it's going to be a good day. Thanks for bringing it up. Appreciate it.
Oh, yeah. And if I can step onto my soapbox for a second, we love our friends at ASCA. We love our friends at Becker's. And there's a lot of happy, smiling faces when those events conclude. The state shows, though, and this kind of ties into Bill Prentice, the CEO of ASCA, his viewpoint on the ASC in general is that it has to start at a grassroots level. You need to be involved with your state association because there's great education at the national events, but that state specific or that region specific curriculum that you put together for the New England ASC annual conference, there's a ton of value there. It's just something you can't miss, especially to advance the cause of the ASC.
Right. No, and we thank you guys for, for coming and sponsoring. I think it's going to be great. My vision is maybe potentially down the road to kind of unite some of these groups with nothing burdensome, maybe a quarterly meeting type of thing where we can kind of lean on each other a bit, network a bit, because I feel those ASCs that don't have a strong association, there's no opportunities to kind of network or ask questions and that type of thing. So if we can pull something together with that, it would be fantastic. So we'll keep working on it.
Yeah, opportunities to provide curriculum, opportunities to get state reps, get your Congress people into these events, because awareness for this perfect venue of care in healthcare, really the only one where patient, provider, and payer are mostly in alignment. Got to keep spreading the good word.
Yep.
So you're obviously growing big time, going from 3 ORs to 8 at your new facility. What would you say, Greg, are some of the winning strategies for your ASC? What has contributed to growth? What are some words of wisdom maybe for those looking to take the next step?
Well, I mean, where we've kind of had our biggest success is kind of why we set out to do it in the first place, having a physician-led organization that kind of lead from the top, but kind of with their culture and how they do things. And it's not magic, right? It's just doing things efficiently and the right way. And so not only do we have, really, really great patient satisfaction from our wonderful staff and nurses, but our physicians like to come here because it's efficient. Back in the day, I remember some docs that were kind of institutionalized, if you will, at the hospital. They'd say, listen, I know I'm an owner and, there's some profitability now and again, but if I never made a dollar, it still made my days that much better because I got out. I did 1.5 times the amount of surgery in the same day, and still got out earlier and spent more time with my family or what have you. And that's kind of been what it's been like. And I think it's things like early on, we had a management company and they really pushed having per diems, and they said per diems are the way you save money, no benefits, blah blah blah. And certainly we did, and we tried to have those per diems in there. But I think we made a move early on to bring in full-time staff because they got to know the physicians and how they do things, and there was consistency there, and it led to our efficiency and led to the doctors being happy. Doctors walk into a room and they don't know a tech or they that they don't have a tech they like, that type of thing. They don't know their preferences. They have a bad day, right? But in our place, they have consistency with the techs. They know everybody, consistency with the nurse and staff, and they have great days. And so I think that's helped us. We do have a lot of hospitals in the area, obviously a really strong hospitally dominated area, and which one of our challenges, obviously, a state association for ASCs. And so, this freestanding ASC model, physician led, is still very rare as opposed to other parts of the country. And so we were successful at recruiting other doctors to come in with along those lines, right? Saying, hey, listen, there's an opportunity to come be a part of something, lead the charge, have really, really, dictate kind of how we do things and that type of thing. And it's worked out really well. Obviously, we convinced the state that we had enough volume and patients for, making that expansion, because we are a pretty strict DON state. And there's been a couple of DON instances recently where some hospitals have been denied. And so we were very fortunate that they listened to our application wholly, and we had the doctor support, and here we are. We're just kind of itching to open.
Yeah, in that string there, you mentioned culture, and ASCs can sometimes have a really interesting dynamic between the physician culture, the surgeon culture, and then everybody else. But really high performing ASCs have it melded. You mentioned physician led, so obviously culture is a huge part of what you're doing and building at Boss. How would you encapsulate that sort of into a phrase? What's the elevator pitch for your culture, Greg?
Well, I kind of said most of it, I think, in terms of like leading from the top, because that's really the key. Early on, again, you had the situations where you thought that everyone would say you could sell staff because you have no weekends, no holiday, no call, all that kind of thing. That's true, right? And that worked early on, and it still does work to some extent. But again, being in a hospital-dominated area, pay is key, and we've certainly seen that our pay and our kind of budget for staffing has gone kind of through the roof. And I guess I would say kind of maybe rightfully so. I always say there's certain things that make staff happy, right? With doing a job, commute, pay, and obviously how they feel while they're working. And so we had to make that adjustment. ASC's got away with it for a bit, but we had to kind of get in there and pay people well, but not only pay them well, have great benefits. And sometimes you can kind of get around. A lot of people now know what ASCs are, and staff come in and they say, I know what I make at the hospital. I know I can't make as much, but one thing they do look at is benefits, right? And so they want to make sure they have enough PTO. They want to make sure their healthcare costs, well, probably would be more expensive than a hospital just because of pure mass. But their hospital healthcare costs are equivocal, or there's some kind of benefits, and we've gotten around that with paying for a portion of deductibles and stuff like that, making them really attractive. And then of course things like 401k and maybe profit sharing or some kind of bonus structure that's tied into cost savings and efficiency. Those things are really key, and those are some things I think we can do perhaps better than a hospital because we have a smaller controlled environment. I always say that I'm not in the business, even though I run the state association for ASCs, I'm not in the business of bashing hospitals. Hospitals, they're a great part of our healthcare, and what we do here in the state. There's a big part of, and actually, I never argue against them getting paid what they do. I think they should get paid what they do. I just don't think we should get paid. I think we should get paid more than we do, right? But having said that, like I always say, like it's not magic what we do. Some of it's just inherent because we're a smaller footprint, and we have a smaller amount of staff, so we can enact change quicker. There's not as much red tape and like robust boards and hierarchy levels of leadership, and so we can enact change quickly. And I think staff realize that, and the physicians do as well. We can bring in equipment quickly and supplies, and we can make a culture shift if we needed to on the fly. So those are some of the types of things we've been doing here. Again, leading from the top, and not only the doctors, being pleasant in the room and kind of staff, nice to the staff, but even their acknowledgement of staff for having a good day and saying thank you, little things, and our management as well. And listen, I'm just as guilty. I think my first scrub tech, who's no longer now works at another sister site down the street. But my first OR nurse, PACU nurse, a lot of these people are still here 22 years later because of, again, culture and just, doing things for the staff and recognizing them. And I think it can just be little things, and I need to do a better job of it sometimes. But knowing that people are on vacation, recognizing that, and asking them about their vacation when they get back, or asking about how their kids are, or that type of thing. Those are little things that people, kind of feel like they're valued. And I think it's helpful. It helps these days with culture.
Yeah, that's comprehensive. What a great response. And then one piece that's kind of a sub point to culture, and I want to set the table a little bit. You're still seeing all these headlines around the staffing crunch, and with a culture that you've created and continue to imbue into staff, that doesn't sound to me like you're dealing with same day procedure cancellations because we can't turn this room quickly enough. We don't have the tech that we need, whatever. But there's still a lot of heartburn and a lot of friction out there with staffing. And that ties into technology too, because the ASC for so long, present company excluded, the ASC for so long was doing things on paper, analog processes. Just throw people at it. We'll hire another couple people and we'll just solve this workflow issue with labor. That was never the right thing to do, in my opinion. And now that's, for many centers, that's not even a possibility, to just go make the hire because we need this one thing done and we'll just have them do it. How does technology and being able to do more with less, even if you're fully staffed, play into your culture, Greg?
Yeah, I mean, it's been tremendous, and I think I probably was one of those people early on that didn't embrace it just because we knew how much cost was associated with it. And again, we really do have tighter pockets just because of the inherent way we get paid, right? We do get paid significantly less than the hospitals, and here in Massachusetts, it's really bad. We don't get paid for implants in a for the most part in a orthopedic facility. that can be really, really bad. So our margins are tighter, and so you don't embrace it. So my suggestion would be, as you said, to work smarter, not harder, and even it doesn't cost you anything to go on a demo and see what things are about. And certainly, managing our staffing through an app where they can actually request time off, or they can see their shift and all that kind of stuff. You can make changes in the fly, so it's not on paper. EMR, again, a big cost, but the efficiency it's bought to it, and if you choose the right one, how your staff, your surgeons and your staff can embrace it because they can get into it and kind of, and it just makes their day go along because they're just clicking on stuff. We've seen technology here. I've been very, very hesitant early on. I was getting approached by a company that did RFID tags for our patients, tracking them throughout the facility. I didn't see the ROI, and for us, it's been tremendous for me to be able to track a patient, be able to watch turnovers and throughput and all that kind of stuff, and pull metrics out of there. Again, a spend early on, but it's been fantastic. There's some patient satisfaction elements that come out of that as far as communication goes. Communication for our joints and our spines, our higher acuity cases. Communication, managing their point of care has been really, really helpful. And then, on the case costing side, we're probably still a little behind. There's an element of our EMR that we're looking to go to. One of the limitations has been, you know, actually physically scanning items is kind of tough because there's a company now we're talking to that we're trying to get to integrate with our EMR because we think they can help out because you're scanning. The nurse doesn't want to sit there and enter items, right? Right now they enter implants and it's stressful for them, right? It takes a lot of work. And so if you can streamline that, and then of course, again, I know you actually instructed me ahead of this not to talk about you guys, and it's not a commercial, but I'll be transparent. Like early on, I met with you guys, and I kind of didn't really fully grasp it until I saw it, and I recognized now as a clinician, right? I'm in the OR, but I don't dictate afterwards. But I do see the struggles the doctors have, and it's just another step, right? And some guys, if you're trying to move along quickly, you can get hung up in that dictation step, right? So for me to see, oh wait, they can actually have this thing on the fly, and it's intuitive, and I didn't believe it till I actually saw it, and so it's somewhere for us that we're looking to really. It's kind of put. I'll tell you the truth. It's kind of puts the cherry on top of our new site, right? Because we're automating so much, and our ORs are really integrated, and it's really nice. But that process would still exist. The antiquated get in the phone and dictate, right? And so now going to this thing where they're going to be able to walk out the door, and they already have this tracker on the wall, so they know what's coming next. But they, on the fly while they're moving, they're dictating, and it just keeps things going. As part of that, I always like into a pick crew, right? A pick crew comes in with couple people, and they do their one job, and they do it well, and they get out of there, right? That surgeon has to dictate that case for us, and some don't because there's things move so quickly. So now to get this thing automated, it's going to be great. So, and the best thing for you guys, and again, I hate to be I don't hate to be a plug for you guys, but no, that's not what you wanted. But you associate technology a lot with cost, and to have somebody come in that's cost competitive with your dictation service is really, really helpful. So again, I will give you guys that, and I applaud you guys what you're doing, and certainly I applaud the vendors that we're working with now. Again, from our EMR to our costing to our tracking, I mean, they're just fantastic, and it's going to help us a lot in our new place.
Well, that's huge. Kind words there, and just to go a little bit deeper into technology and the cost. That what you mentioned for DocBuddy, obviously, it's an instant op report generation tool, and that's great for surgeon satisfaction. They use their phone, their op report's done, it's signed, it's back to your EHR, they move on with their day. So there's a downstream effect there. Your revenue cycle will be faster. But what I really wanted to pick at though was the patient tracking. I mean, there's a cost. And at a surface level, you look at it and you go, I know where my patients are. I don't really need them RFID tagged and chipped to go through my facility. But you do, because on the back end of that, and you said this, how quick are we turning rooms? What's the throughput like? What do you have insights? And this is where healthcare is just lagged so far behind. That data that you get, you can make decisions off of that and provide better patient care.
Surgeons are scientists, right? And so that you have a surgeon who's constantly late. And maybe you don't want to go after that surgeon because they're tough to approach, but maybe you instead at a board meeting present globally across an unblinded or even blinded and on time start percentage, and that's how we did early on. Some of our earliest success was because we were meeting monthly as a board, and as all clinicians, and we were all physicians, and they were going through everything from costs to this, what make things better, and they're competitive individuals by nature, and so you're pulling off like, hey, why is this turnover time longer for this surgeon? Again, maybe he's taking time dictating, and the dictating things will help him along. Maybe he takes a lot of time with his patients and doesn't have them ask questions in the office, so he has to answer them here. Maybe it's not the surgeon alone. Maybe it's the team. And so once we can track those cases back to that team, the nurse, the tech, the anesthesiologist. I mean, and then just on the patient satisfaction side, I mean, we get a lot of comments on the tracker in the lobby. That's real time, and the patients get a text that the family members get a text that say when patient went in the OR, when they get to the PACU. I mean, it's just nice for them to know kind of what's going on, because if you think about it, if you've been there, they're in the lobby sitting there waiting. You don't know what's going on, and nobody has the bandwidth to update them constantly. So now it's all automated. Why wouldn't it be, right? For me, it's the eye in the sky. I can see at any time what's going on, and I can make a phone call to my nurse manager. Hey, why are they not in the room yet? Or are we going to, bounce so-and-so and that type of stuff. So it's worked out really, really well,
Yeah, I love it. And I think the ASC in particular, but healthcare at large, is moving past the gadget phase and looking at these gadgets actually provide insights, and we can make business decisions based on the
Yeah,
data.
for sure.
Can't do that on paper. No chance on paper.
Yeah.
And then it's hard to believe we're kind of creeping up on Q3 here. I know we still got all September, and then we get to that Q4 rather. We're in Q3, rapidly approaching Q4. What's on your radar to close out 2025 strong? And then maybe what are you looking forward to in 26? I know there's some proposed CMS rules for 26. There's some talk about the IPO list. What's going through your head as we get closer and closer to the new year?
Yeah, I mean, I'm just in a different state right now than all the other administrators, because my one focus is like getting our new place open. I mean, we've spent all this time. We involve staff, we involve the doctors to custom build this beautiful site. That's we're going from 10,000 square feet to 33,000 square feet. A huge SPD area, huge storage. Like it's the ORs are fantastic, and we just can't wait. We have all these doctors who are kind of itching to go. And so for me, it's just been hammering that and going to be hammering the surveys and getting up and going. And then obviously for us, we're going to be on a growth curve, making sure our ORs are full, and what we can do to streamline all that, the whole process, and make sure we have enough equipment, and we're moving things through efficiently and all that kind of stuff. So that's our biggest thing. And we'll finish out that way and then work to, just like our new site, like our site right now it was beautiful in '04, but it's kind of like bare bones. It was shove 3 ORs, a PACU, pre-op, some storage, maybe a little SPD, which we have, into 10,000 square feet, because you don't want to pay, a lot per square foot for unused space, right? And the new place is the total opposite. Some would say it's kind of overbuilt, but it's what you need now. The doctors want bigger ORs. There's more equipment in there. The SPD, there's more equipment going through the SPD department. That has to be big enough. You never have enough storage. And it has to be streamlined, And then our lobby is huge, and it's really, really. I always say that you go in to get your card, serviced. You have this beautiful lobby with an area that has, like, area to do work and food and all. That's what we're doing. We're doing a cafe, and we're doing little workspace areas. And so there, oftentimes those patients' family members are the ones who also give some input to that survey. And this is all public information now. So we're having spent a lot of time on our patient satisfaction and making sure patients are well served. And so that'll be some of our agenda items for the 2026 is a lot of ASCs don't have a marketing budget because their surgeons bring their cases to you, right? And so you don't necessarily, patients don't call up and say, I need my ACL fixed, right? The surgeon's the one who sends them over. So we're going to do some marketing and kind of get out there and get our name out there and build the brand and do that kind of stuff. We're working to get some outreach for some of the inner city stuff. As I mentioned, we have some great transportation in this new area. And so, making sure we get kind of this comprehensive coverage of patients and making sure they have a good experience is going to be key for 26 for us.
This is going to sound a little high-minded, Greg, but for listeners of the show, they know we fly the flag for ASCs high and proud. Love what the venue care does. It's important to healthcare. I know you've been advancing the ASC since Boss opened, but now with this new facility, that patient satisfaction. Because what's going to happen? They're going to have a great experience. Oh yeah, so I brought so and so to get their knee fixed. I had a coffee, had
Yep.
some pastries. It was really
Yep.
pleasant. They had fast Wi-Fi, all that stuff.
Yeah.
That's what nationally needs to be happening.
Yeah.
Truly.
Yeah. Yeah. It's true. It's true. There's some, there's cross marketing there, right? With if you have multi-specialty center that can be done and can be capitalized on, and just in general, like you said, the word of mouth piece, and especially if you're doing kind of that stuff like in our area, we were the first to do total joints back in 16, 17, and there's still not a ton of ASCs that are doing them. There are some, but it had to be a culture shift, and certainly COVID kind of catapulted that as some of the joint guys were coming out doing surgeries because we were open earlier. But as we do more stuff, like we just did a huge lab on minimally invasive spine to the scope, right? And one of our docs is cutting edge, and so when you start to do those things, again, patients sometimes don't know, they don't know what goes on to the actual surgery, but they know how big their scar is, or what their dressing looks like, or did their wife or husband or whoever have a good experience. That's the stuff that they're actually seeing. Is the facility clean? Was there attentive staff? And so that's going to keep us rolling and going to keep that patient population and that throughput in the future for sure.
Love it. And as we kind of wind down
And I
our
should say, sorry, I should probably talk. My answers probably should have been more along the lines of compliance and Medicare reporting and stuff. I mean, of course, that's in there, but this is what I'm kind of really thinking about. So, but we're not going to say that stuff just in
we
case
know you
CMS.
had those covered. The table stakes, man. We know you had those boxes checked. We
Yeah,
know.
yeah.
And as we kind of wind down here, whether you've got an expert's perspective on this or more of a layman's perspective, what are your thoughts on AI in healthcare?
Definitely layman. I think it's something like the technology thing. I think I mentioned early on. The technology word wasn't what I was scared of, but I was scared of some of the things that were out there and seeing the value of it. I certainly see the value of AI because we've seen it, in use, and practically we've seen it. And I've heard about a lot was recently said about using AI for denials, and we had spoken about that earlier. Not only that, but I just where it comes out as far as like maybe outcomes and how we can kind of enhance what we're doing. I think again, you mentioned it earlier, and I'll say it again. I echoed it before. Work smarter, not harder. How can it intuitively kind of crunch what we're doing and crunch real data and say this might be a better way to do it? And again, for you, as a leader too, sometimes you go up to a staff member, you say we're going to do this now, right? And they say, well, why? And maybe you want to do it anyway, but you didn't have the time to truly crunch the data and put stuff together. And so if you have this backbone of something that's going to do a lot of the work for you, I think it can be really helpful. And I guess again, conversely, I mean, on the surgeon side, right, convincing them of things or having them do something better and smarter and faster and more efficient. I'm looking forward to it. It's going to be exciting because I've seen it, again, and we all do it using Chat GPT and that kind of stuff, and allowing you to kind of organize your thoughts and just throw a bunch of stuff at it, and it puts out a beautiful product. It's tremendous. And so it's people. I think so many people are scared of it. And again, I'm only scared of just because I don't know it enough to talk about it. And so, but I know what it does, and I think we'll see a lot of it come down the pipeline. And looking forward to embracing it. I think what we're doing.
Yeah, we're keeping our eye pretty closely attuned to developments on AI in healthcare. At this point last year, there was a lot of hammers looking for nails, and I think some of those hammers have sort of washed out, and the nails are becoming more obvious. As you said, maybe it's for denial management, maybe it's workflows, maybe it's patient
Yeah,
communications to the degree it makes sense.
yeah,
We're on the right track. Is it a cure-all? Absolutely not. You got to
yeah,
have a really well-defined use case, but I think we're getting pretty close to
yeah.
uh, striking oil with what we're digging
Yeah, I mean,
for.
someone I talked the other day about, you think about supply chain, right? Supply chain and what a struggle that can be. And so, managing inventory and that type of thing. Imagine something that could actually pull that together for you. And then, you'd always have to have, again, early on, so the trust factor came into play, but, somebody kind of checking that, but doing a lot of the legwork. I mean, there's just so many areas where you could kind of use AI and use this type of technology. It'd be fantastic. I'm looking forward to it.
Same here. Well, as we wind down, Greg, where can listeners connect with you? Big on any social medias, LinkedIn, your websites?
I wish I had time to do more of that stuff. I know a lot of people do LinkedIn. I'm on LinkedIn. I rarely use it. Again, you can certainly reach me through my email at gregd at bostonoutpatient.com, GREGD. And happy to talk anytime. I think my information is on the Mass Association of ASC's website as well. Go to our website. Any questions, thoughts, concerns? I mean, happy to talk to leaders like those, probably listening to your podcast out there, and people who you want to know what kind of work we're doing for this and that. Happy to always talk about vendors and kind of successes we've had. Because again, I think the collaboration aspect of this community, the ASC community, is really what's helped us work. You know, we're all kind of competing against each other, but we're really not, because we have our own surgeons. The competition comes at like kind of the practice level. So if we can all kind of work to come together to work on things better, it's I think we're all better for it at the end of the day.
And on that note of coming together, just one more time, if you are in New England, you need to mark your calendar for the New England ASC conference that's happening October 24th in Newton. We'll have a link to that in the show notes. Obviously, DocBuddy will be there. I'll be there along with Kent Darbro, and we're looking forward to seeing all of the attendees and the New England ASC family up there.
Thanks so much again. I appreciate it.
Thank you, Greg. And on behalf of the entire DocBuddy team, thank you for listening. Be sure you're subscribed on Apple Pods, Spotify, and YouTube, and we will catch you on the next one.